Good morning, viewers and listeners. Welcome back to the latest episode of the Free Marketeers. I hope you all had a good weekend. I hope you're all enjoying the freedoms that you now have on lockdown level 3. I hope you're all not going too crazy and getting up to no good. Interesting to see how people are reacting to the different lockdown levels and what's been happening in the country. This morning, I have a very special guest. We're going to talk about all things healthcare in the country, seeing as we are in the midst of a global pandemic. My guest today is Henru Kruger. Henru is a member of the FMF's Health Policy Unit. Henru, thanks very much for joining me.
Thank you so much for having me.
Henru, I thought we'd start with just a broad overview. South Africa went into lockdown on the 27th of March of this year. The government sort of followed this route in the hopes of lessening the peak, as it were. We've all heard the phrase of flattening the curve around COVID-19 infections. So what do you think, just to start off with, what did you think of government's initial reaction and their approach to this pandemic?
Yeah, I think we were all aware that it was not going to be a normal flu. So we all thought, we must brace ourselves for the worst. And me, myself, I was, propagating a lockdown. Mm-hmm. But I think as far the further we progress with this, the less we believe in what is actually achieved with the lockdown.
Mm-hmm. I think fear was definitely an overriding element, as it were. And a lot of us were scared of this new virus, perhaps, and we thought, maybe government is right to follow this hard route. And now it's come to light that maybe this wasn't the best approach. What do you think in terms of how things have unfolded now, specifically, maybe in terms of government readiness, that sort of thing? I mean, last week, for example, I had an article out that people can find on our website just about the lack of capacity that we have, the lack of preparing in terms of critical care beds and ventilators. So if you could touch on some of those things, how it sort of unfolded for you.
Yeah, I think that the main purpose was to actually, get government to get geared and get ready. Mm-hmm. Because, we haven't seen the worst of it. It's only going to hit us, say, around about August. But I don't know. I don't believe that they have actually been able to prepare. Mm-hmm. We have seen a lot of complaints around the shortage of PPEs. Okay. We've seen no protocols in place at government hospitals, and especially the worst hit areas were the clinics. The public clinics and the municipal clinics, they weren't prepared at all. Mm-hmm. So I don't know how far they have actually now progressed in getting ready. But even with the testing, the private sector was ahead in testing for COVID-19 cases. Mm-hmm. And now again, we've heard that there's a backlog in the testing. And I've even now seen scientists complaining that the testing is done not at a fast enough rate. The turnaround time for the results are too long, so there's no real benefit in containing and in containing the virus. And then also they're testing in the public, and they don't have enough resources, so calls are being made to actually just test in hospitals and to actually test healthcare professionals. I've been speaking to pharmacists, which says that, they don't have any PPEs, they don't get tested. It's like when the test has been done by the healthcare practitioner and the nurse, they just progress on to the pharmacy. And then there's no protocols, behind that first line of testing. So, the lockdown hasn't served, that purpose of getting ready. I think at this stage, the workplace is the best place actually to screen and to test. Right. Employers have actually been able to prepare, and I think that's where we will see the value. For instance, with serology testing, I think if we could get that passed by SAPRA, so that we can do that rapid testing at workplaces, I think, we will go further than actually doing those PCR testings in the public, sector.
So just for my own benefit and for the listeners and the viewers, what exactly is that test, and what is the test for? What exactly is that sort of focused on, the testing that you're mentioning?
Yes, serology testing is an antigen test. So it can actually determine if you've had the virus, and you have built up some immunity against it. So it's a good tool to actually determine whether the person that's going back to work has actually had the virus and what sort of effect it had on that person.
Okay, I see.
It's a very quick test. It's very much. You can get the result in a few minutes. So.
I wanted to ask you, maybe this will take us on a bit of a tangent, and I don't want to put you on the spot, but just your thoughts on what's happened in the Western Cape, because we've seen a lot of cases there. So is that an indication? Is that putting any sort of blame on the local government there? Is it an indication that they've been testing well because they've been doing a lot of tests, therefore the number of cases will go up if you get more testing, that sort of thing? What do you think of what's been happening in the Western Cape, maybe compared to some of the other provinces?
Yeah, I must say, when I look at the complaints, most of the complaints do come from the Western Cape, but I do think they've seen a lot more cases than the rest of the country. I don't know why, I can't scientifically explain it, but what I can say is that the reaction that we've seen from the authorities in the Western Cape has been the best.
Okay.
So if you lodge a complaint, if you explain to them what's wrong, they're very quick to actually, act on it and to make work of it.
And what do you? I'm going to put you on the spot now. So tell me if it's not going to work for you necessarily. But if you were the Minister of Health, when the sort of a global pandemic hits your country, would you have? Is there a better way? Maybe in terms of allowing each province to handle it for themselves? Is it a case of allowing each hospital to handle it for themselves? Maybe the private sector as a whole? Do you think when it's a pandemic, the government has to assume some sort of role? Just maybe a theoretical perspective that you have there. Of course, the theory is always different from the practice, and what we say in theory never shakes out in practice 100%, but just what you think in terms of what you would do in that position.
Well, as government, you have the power to do something. I mean, if you look at the Disaster Management Act, it's specifically geared for a disaster.
Sure.
This is a pandemic, so it's a disaster. So you pool your resources. And I mean, you must play to your strengths. We've seen other countries that's immediately engaged with the private sector.
Right.
And I mean, in South Africa, let's be honest, the private sector is very strong. And, if you look at the private sector response and actions, it's been very efficient. You've seen and you've heard about hospitals like Mediclinic and Netcare that's starting to get full, and they're coming to capacity, and they actually send these patients to other hospitals. They've been doing this for ages. They're very much geared to do this. And I've seen Netcare's responses. I've seen their screening policies. I've seen their education and training regarding PPEs, protective clothing. It's been very efficient. So if I was government, I would really pool resources. We've seen a block exemption, from the minister in terms of the Competitions Act, but they haven't addressed the prices, the tariffs, the issues there. So now you've heard that there's an agreement with private hospitals, but still the practitioners are out there. There's no agreement with the practitioners. Private practitioners haven't been geared. They haven't been given PPEs. They've actually not received any assistance. And, it's a lot of resources that you're not utilizing. And then you go and you actually import Cuban doctors, and you spend 439 million on them, and you just, make your local practitioners, so much more despondent, because it seems like, you're not actually looking after them.
And as with most things, I assume having no local knowledge of the people around you would help in this sort of situation. It would help if the government sector, it would help practically if the government and the public sector actually utilized their health practitioners in the country who have been part of their communities and who know the people around them.
Oh, for sure. I mean, if you look at the private sector, it's much more focused on family medicine.
Okay.
So you've got that, focus on families, and, you've got the history. While in the public sector, it's very much disease focused. It's always been disease focused with TB and HIV. And now they say, that you can actually treat COVID-19 the same as you do with HIV, with screening and so on. I still believe the best approach would be, like you say, in the community. Mm-hmm. And see why they actually put the Cubans. The Cuban system is much a community-oriented primary care, setup. So I believe in the private sector, you would go very much further in actually doing preventative care than just going out into the public and doing mass testing and, squandering resources. That's not really effective. You should have a community approach.
Right.
And for so long, we've been propagating for the public health system to be integrated into a community system, and for family medicine to actually be, proposed and to be furthered.
I wanted to ask you about, maybe this is throwing forward a bit into the future, but I think it's important to keep in mind while we're in the midst of this pandemic, and I know it's very tough for any of us to think, for the next year, never mind the next 5 years or the next 10 years, but there have been renewed calls for South Africa to implement the National Health Insurance, the NHI. Number one, I'm sure most people are aware that there's simply no room in the budget for anything like this, to finance anything like this, but that doesn't usually seem to put off those in government who are committed to these grand projects that they want to show the people, we care about your healthcare, we care about bringing down the prices, we can give you healthcare services. So of course, why wouldn't this be a good idea? But on your point of, I'll segue into it this way, the point of the private and public sector working together and having things integrated better. Surely now would be the worst time to implement this sort of national management monopoly of people's healthcare needs. We've got 55 million people in the country. To think that a bureaucrat or a certain committee can account for everyone's healthcare challenges and needs, to me, is quite crazy. And second of all, it'll just destroy what good there is in the private sector. Of course, we know that there are issues in the private sector, but I thought I would just get your take on maybe a better version of an NHI that could happen going forward, not the sort of top-down monopoly management approach that's currently being punted.
Yeah, so again, government has lost the opportunity before COVID-19. Our country was in a state even before the pandemic.
Right.
Economically, we're not in a good space going into this pandemic. We weren't in the position that we were in 2009. We had a strong, balance sheet as a country. We're really not able to afford any new grand projects like you've called it. So what are you left with? We had a total health market inquiry where a lot of money has been spent. All the stakeholders have made submissions. There were a lot of inquiries done, and there's recommendations that came out of that. And those recommendations you can implement, but there hasn't been the political will to do that. It's almost like government or private sector to fail. And you can't do that. It's a resource in your country that you can utilize. If you look at the reforms that's necessary in the medical scheme space, you can open it up for a whole lot more of the population of South Africa. And you can do that now without spending too much money. It's just a matter of reforming and to actually take away, the 25% solvency level that medical schemes have to adhere to, push it into a risk-based model, Look at the cross-subsidization between options, take that away. Look at the PMBs. I know there's a massive, reformation of the prescribed minimum benefits that medical schemes have to provide for. And then also, make it mandatory, and do that risk equalization fund between the medical aids, and up the competition.
Yeah.
This is something, if you stimulate it, you can get a whole lot more traction out of the private sector. You can open it up to so much more people, and the public sector is struggling. If you don't have money to actually put the infrastructure down. I've just now read about Tygerberg Hospital. That's now the epicenter of COVID-19. If you look at that hospital, get the private sector in, get participation, get the capital in. There's a lot more stimulus that government can actually put into our economy. Allow companies now to put out shares. Because you need to access capital now fast, to keep the players in the market and to expand and to put down infrastructure. Now is the time to actually invest. Like Bill Gates said, he's been warning the world a time ago that this sort of pandemic will not go down good because there hasn't been any investment into a pandemic like this. But now, let's do it. Let's see what we can do.
Yeah, the only countries we've seen probably handle it the best is South Korea, and that's because of their previous experience with SARS. They realized what they should do going forward, and they prepped for it. Of course, there are issues around privacy concerns, some of the tracking that they've done, and that whole thing. You can have that debate, but at least from being a pragmatic, being progress, adopting the view of progress on the part of government, they tried to learn from their mistakes in that country. I don't know if you've looked into what happened there at all. We could also touch on Sweden and how that's being held up as an example of a country that didn't follow the lockdown approach. Is there anywhere else around the world that you think any particular countries did well with this, or do you think across the board it's been very much the wrong approach?
Well, like you say, it's rightly so. You have to localize your response to the pandemic.
Okay.
It's not one size fits all.
Right.
For instance, Italy, they've got a aged population, and they didn't cater for that. They didn't, respond to that, and they lost a lot of citizens because of that. You're looking at Sweden or Holland that didn't have a lockdown, because they know their population and they know they've got a strong healthcare system. They know their population is healthy, and if 60% of your population, actually contracts the virus, you get this herd immunity.
Right.
So you have to localize. I just think, looking at the US, I think they actually have struck the balance correctly. They locked down not too early. They locked down, and they flattened the curve, and they also managed now to save the economy. If you look at the stock markets in the US, it's rebounding. They've given themselves a chance. I think our lockdown is just it came too early, too hard, and we didn't have a good economy going into this, and retracting it now is destroying the, and food security is really now the problem and the crime that goes with it.
Just a question I had on Africa, and of course you can speak to South Africa specifically, but something I've been thinking about and trying to find out about, so maybe here I'll play devil's advocate on the part of government. We aren't seeing as many cases as the rest of the world, so Africa seems to be okay for now. Of course, the peak might come later, but do you think there's anything in Africa? Is it the climate? Some people have talked about that. For example, we've done a lot of stuff regarding TB, and that might help in some ways with people not getting the virus. But have you put any thoughts into that at all? Why we aren't seeing that? Maybe then the South African government can say, yes, see, we did hard lockdown. That's why we aren't seeing these high numbers. What do you think about that sort of approach or answer?
I'm thinking about, I think Malawi tried to do a lockdown and they took it to court and it was immediately
Oh.
thrown out by the court. So I just think geographically, Africa, you don't see that much foreign, maybe tourists coming into the geographical area.
Okay.
I also think climate plays a role because I think the colder it gets, the more problematic the virus becomes. And then also the age profile. I think, if you don't have a really old population, you will see less serious symptoms and also much less deaths.
Mm-hmm.
And also maybe,
Sorry, go ahead.
Your non-communicable diseases. I've seen now studies that actually says that the most COVID fatalities is because of diabetes. Mm-hmm. So I don't know what the prevalence of diabetes is in Africa. It may be high, but I don't think so, because it's usually, obesity and, metabolic syndrome leads to diabetes. So maybe it's also a factor, And immunity. I mean, if you've lived in a wild country where you are exposed to pathogens every day, you do build up some strong immunity.
So the sheltered communities of Europe and America, we're seeing the effects of that now. And also, I guess that, as you mentioned, Italy, that affectionate culture, because for them, I mean, kissing on the cheek, that sort of thing with family, with friends, that's a big thing. And now we're seeing, I don't think people are really accounting for those cultural differences and the importance thereof. Maybe the Afrikaner approach of just shaking hands and leaving it at that, or even just waving, is the better approach now.
No, most definitely. I mean, I think that's why South Korea has been so successful. They used to wearing masks every day because of pollution levels, or I don't know, protocol. They don't see it as funny to wear a mask. And I mean, I think they maintain social distance. So even if you don't, if you use a mask, that definitely lowers the infection rate.
Yeah, hopefully people can learn at least some of these behaviors and things going forward. And hopefully we can show and learn that we don't need the government to make these decisions for us when a risk approaches people. Of course, some people are going to make the wrong decisions and expose themselves and their families, but many others will take the right approach. Henru, just to wrap up, I thought I would give you the final sort of word. Just any parting thoughts you want to leave us with? I mean, I've learned a bit today talking to you about just different aspects of the virus and how governments can handle these things. But just, I thought I would let you leave us with anything you want people to think about and chew on going forward.
Yeah, I think the biggest problem for me is still the siloed approach in South Africa, the public sector and the private sector. I would love to see a South Africa where private can refer into public and public can, transfer back to the private sector, because I believe a healthcare practitioner is a healthcare practitioner. A life and a body's health, is universal. It shouldn't be determined by a public system or a private sector system. And I do believe government should really also now assist the private sector. It's not going to do us any good to now destroy the private sector or to just neglect it. I think it's worth saving, and I think, public-private participation going forward can have very huge effects to the betterment of us all.
Yeah, I think that's a good note on which to end. I think most South Africans, if not all, want to see things just working well and would be very open to the public and private sectors working together in these ways. And it's sort of, we need to see an embrace by the government of the private sector, not an attempt to undermine and destroy those resources. It is South Africans, I think, in general, want to work hard and want to contribute, and they should be encouraged by the government to do so, not attacked and demonized in different ways, and just government wanting to control them all the time. So I agree with you there, and I hope very much we see that going forward. Just on a final note, any way you would want the viewers and listeners to follow you or listen to you, talk to you on social media or any websites, anything like that?
Oh, I do have a Twitter account, so I think that would be the best. I do post regularly, so I'm also on LinkedIn. That's also a very nice professional platform, and that's also where I post the most scientific sort of researched articles. So I think that works well as well.
Okay, perfect. I'll link to all of that in the description below for those of you watching on YouTube. And I think on that note, Henru, I want to thank you for your time. Thanks for joining me today. I really enjoyed it, and I'm sure the viewers and listeners have as well. So thank you very much for giving us your time. Viewers and listeners, to you, thanks once again for listening to one of our episodes. We greatly appreciate your support. If you find value in our work, please consider donating to the Free Market Foundation. You can find that link on our website, www.freemarketfoundation.com. Please like this video. Please share it on your different social media platforms. And if you're listening on Spotify or Google Podcasts or any of the other audio platforms on which we are, including iTunes, please leave a rating, and also please share those links with your friends, with family, with people you think may be interested in our work. Now is probably one of the most important times in the history of this country that we get the right ideas out, that we say the right things, come up with the right policy proposals, and you all engaging with our work and sharing that goes very far to helping us spread the right kind of message. So on that note, I will end today's episode. Thanks once again for joining us, and we'll talk to you again very soon. Bye.